It's a great pleasure to have you here, ma'am. Thank you for
Hi,
joining in.
no, it's a great honor to be here. Thank you for having me. So, I have some slides that I'll be showcasing. Is everyone here? Can we start?
Ma'am, shall we start with a small keynote and then we will start the webinar?
Yeah, yeah, definitely.
Thank you, ma'am. So, a very good afternoon, everyone. It gives us immense pleasure in welcoming you all to the Nirmaan series of upcoming years.
Sashakt has planted a fruit-bearing plant at Ahmednagar, Maharashtra, under the project Tree for our COVID-19 Heroes of Sankalp Taru Foundation, with the help of the landowner, Mr. Santosh Dhondiram Kardile. For every leader visiting us, we would like to welcome our leader, Dr. Radhika Batra, who is like those fruit-bearing plants in this society, who are self-made, evergreen, and making this place a better one by their mere presence only.
What you leave behind is not what is engraved in stone monuments, but what is woven into the lives of others. While most entrepreneurs are motivated by the potential to earn profit, the profit motive doesn't prevent the extraordinary entrepreneurs from having a positive impact on society. Social entrepreneurs identify resources where people only see problems. They begin with the assumption of competence and unleash the resources in the communities they are serving. We are privileged to have Dr. Radhika Batra ma'am share her invaluable thoughts on this topic, social entrepreneurship.
Ma'am has graduated from Santosh University, Ghaziabad with an MBBS degree and has also completed her research fellowship from University College of London in the field of infection and population health. Post that, she completed her Doctor of Medicine in Pediatrics from Santosh University. She has served as registrar in the Indraprastha Apollo Hospital. She has worked as a senior resident pediatrician at Employees State Insurance Corporation. Ma'am has been an ambassador of prestigious organizations, namely the Institute of Economics and Peace and One Young World. She has also been recognized as Forbes Asia 30 Under 30. She has been awarded Healthcare Innovation and Entrepreneurship Award by AIMS New Delhi. Currently, ma'am is the founder and president of Every Infant Matters, which is a non-profit organization dedicated to improving the lives of disadvantaged children and ensuring universal access to healthcare. Now, we request Dr. Radhika Batra ma'am to take over the stage. Over to you, ma'am.
Hi. Thank you for having me here. It's a very big honor to speak at a institute as prestigious as IIT. And my grandfather, in fact, he passed away last year in the Delta wave. He was an alumnus of IIT, not Delhi, but he was from IIT Roorkee back in the 1950s or 60s, maybe. So I have a very special bond with IITians, and I hope I can, help you people and do justice to this lecture. So, your organizers introduced me very correctly. I am the founder and president of Every Infant Matters. I am a pediatrician by profession. Currently, aside from my non-profit work, I'm also getting another degree. I'm training in the field of neonatology, which is a specialized branch of pediatrics where cater to tiniest of babies, that is from birth up to only 28 days. So diseases of the newborn is neonatology. And that's what I'm doing some research in and training in right now for the next 5-6 months. So that's about me. And coming to social entrepreneurship, the topic which you guys have chosen for me to speak about today. So, when Vipassana had approached me, I was quite skeptical because I
Excuse me, ma'am.
just a need and just an idea to make a change in the world. How someone like that is me, really, set up a non-profit and just took it from there, took an idea into and scaled it and brought it up and made it into a non-profit, which is Every Infant Matters. So I hope I'm audible, Pasna.
Yes, ma'am, you're audible.
Okay, perfect.
Yes, ma'am.
Just 1 second, I've lost my audio connections again.
Vipassana, am I audible now?
Yes, ma'am, now you're audible.
Okay.
Yes, ma'am.
So, are the slides visible?
Yes, ma'am, the slides are visible.
Okay, and just tell me if they are changing.
Yes, ma'am, they are
Are they
changing.
changing?
Yes, ma'am.
Okay, perfect. Okay. So coming to what social entrepreneurship is about, what I did, what happens when you decide to take on a path which is a little aside from what has been set out for you. So, like the slide, I've sort of mentioned in the slide, social entrepreneurship is a journey fraught with difficulties. It's very difficult to lead a non-profit because there's no monetary rewards involved. There are no monetary incentives. There are no material incentives involved. There is a lot of resistance from your work colleagues, from your friends, from your family, all of whom are very keen that you should focus on just what is your mainstream work and not deviate from your goals of your for your career, for your family, for your marriage, everything. It's very difficult to start something when there is so much resistance, and there's always going to be resistance when you want to do something even slightly different from that chalked out path for you, specifically in a country like India, and more specifically if you're a woman. So anything, for women, it's very concrete. It's laid in stone. Okay, by 30 you have to have your first child. By 28 you have to be married. But the minute you say that's not what I want to do, I want to do something different, and I want to focus on making the world a better place, you see the kind of resistance you'll get. So it's a journey fraught with difficulties, but the rewards, they cannot be imagined and they cannot be measured. There are a lot of intangibles, the kind of good karma you get, the kind of blessings you get, the blessings you get not just for yourself but for your entire family. They are unimaginable. Like, I get people telling me that, ma'am, आपने ऐसा नहीं किया होता तो शायद हमारा बच्चा नहीं बचता. And that is something which I don't think any amount of money can compensate for. So that is what social entrepreneurship is about. And what happens in social entrepreneurship is that anyone, any of you listening, anybody in the world, even a 15-year-old, even a 10-year-old, can become a social entrepreneur. The main point here is that you need to have an idea and you need to have drive. You need to choose a path and a focus that you are very, very driven for, that you feel from within about. It could be anything. You could go outside on the road, see a stray dog in pain, and you could think that I want to do something to help the stray animals. You could see trees being cut down. You could see deforestation happening in your locality, and just not be, not get any sleep at night because you start wondering about the implications of climate change. You could be in a setup where children are employed in factories, and you could just be overwhelmed that these are children who need to go to school. Why are they employed in factories? So it could be anything. For me, it was health and its inequalities. So what happened for me was that when I was in medical school, first of all, I was unwell myself, and the kind of disease that I had, it was a rare kind of tuberculosis. So it took a lot of energy on my parents' side to actually get it diagnosed and treated. And this is when I came from a very privileged background. So I had started wondering that had I not had these privileges, had my parents not been doctors, had they not had the money, then this disease would have never been diagnosed. And if it had not been diagnosed, I would have not made it. So, these are just the thoughts which had started coming to me when I was in the beginning years of my MBBS. After MBBS, of course, I joined a government hospital where there was no end to the kind of death and devastation that happened on a daily basis, specifically because the numbers were so huge and the inequalities in the fields of health was so apparent. There were children dying because hospitals didn't have ventilators. There were children dying because they couldn't afford the medication and the government was not giving it to them for free. There were children dying because they needed something like a heart lung transplant, which costs either crores, or you need to go to the US and to a foreign country where surgeons are specialized enough to do it. So, what is why is there so much money in things like sports, in so many things, but not in health, is the question that used to come to mind. And another question which used to come to mind is that if we can say, see, there are things in life which you cannot prevent. There are diseases like Down syndrome that one is born with. There are cancers which happen. There is COVID which happens to an old person and you cannot do anything to save that person. But a child dying for something which a vaccine could have prevented, a child becoming blind because it doesn't have food to eat, because it doesn't get vitamin D, that is, I think, it's just appalling, and it's just horrifying to think that these things are happening daily. And what I saw was that 1 million hungry children used to become blind every single year because of vitamin A deficiency. Now, vitamin A is something that you and I, we get from our food. We eat eggs, we eat good quality food, and that's why we get vitamin A. But these children, they survive on very meager scraps of food, and there are 250 million children such in the world, and 1 million of them will become blind every year. So this is a travesty of justice. No child should have to suffer just because there's not enough food for them, right? So this is the kind of cause that I chose. Now, like I said, that hunger and malnutrition was my focus, but the focus could be anything. It just needs to drive you enough that you actually get up in the morning and you think that, okay, aside from my 10 things that I have to do, otherwise I should do 5 things more, because this is something which I feel very strongly about. And that is the whole idea behind social entrepreneurship, that you do something aside from what is set out for you. So, coming back to my story and my journey. So, hunger and disease, of course, as I saw in my residency in my medical college days, that they have a cause and effect relationship. Hunger is something that all of us take for granted. We feel hungry, we go to the fridge, we order Swiggy, Zomato. But there are children who don't have these luxuries. There's a country called Yemen, where every day, I think, millions of children die because they don't have water and food. There is a country called India, where every year so many children become blind because they don't have vitamin A in their diet. There are countries in Africa where so many children suffer from worm infestations, and whatever they are eating, the worms absorb them and they don't get any nutrition. And as a result, they become malnourished and they have lots of complications of malnutrition. They have cognitive deficit, they have poor school performance, low IQ, and ultimately they succumb to a deadly infection, which is even more important in a situation like COVID, where immunity is everything. So imagine if there are so many malnourished children, sorry. So what is going to happen to them in a situation like COVID? So they're just going to, this is why the numbers of PICU admissions have gone up in this third wave, because of the number of children being infected and the numbers being so high in terms of poor resistance and poor immunity. So just to give a background, there's a chief economist of Citi. I think you guys will relate to this more than I will. So there's Samiran Chakravarti. He's the chief economist at Citi. He reveals the precarious financial situation of millions of Indians who are a part of the informal economy. So informal economy, of course, you all know what it means. And he says that 40% of those Indians, be it a rickshaw puller, be it a construction worker, he cannot afford to buy a packet of biscuits worth rupees 10. So that is just, I would say, it's very, very eye-opening when you think of a statistic like that. This is what I personally felt very strongly about, that hunger is something which is so prevalent and it's causing so much of devastation. It's causing so much devastation that hunger, Vipassana, the slides are changing, right?
The slides are changing.
Okay, so we're on the hunger is not about feeling hungry, one slide.
Yes.
Okay. I'm sorry, sometimes I keep talking and the slides don't change. So it's just,
Okay.
if there's any clarification, just stop me in the middle. And if someone wants to ask something, just point it out.
Sure, ma'am.
Okay. So hunger is not just about feeling hungry. It's, hunger causes a lot of thousands of complications, and the most horrifying of them being irreversible blindness, which is our focus at Every Infant Matters. What we do is that we give children from 0 to 5 years vitamin A drops, and these drops prevent this devastating consequence of malnutrition. So they prevent this blindness. So just 2 drops, which cost less than the price of a McDonald's ka burger, they can save a child's life from blindness. So this is the kind of impact that can be made if you just take up something and turn it into, find a solution, use your head, put some hard work towards it, and just turn it into something so, I would say, powerful. So, like, I was coming to what should be your effective strategy when you think about starting a social entrepreneurship, or just just something on your own. So the first thing, like I said, you need a focus. You need an idea. You need a cause that you feel very strongly about. You have to decide why is it that you feel strongly about. More often than not, it comes from some sort of personal motivation. So I was motivated to work in COVID relief because my grandparents at that time had COVID in Delta, and they were so unwell that we had to get them remdesivir, we had to get them hospital beds, ICU beds, and nothing was available. So after, it took me, I think, 100 phone calls to get 4 vials of remdesivir. And that's also, again, that, thinking that I come from a place of privilege where I know a lot of people in the pharmaceutical and the medical sector. That just made me think, like, what is happening to the common man? They don't have such contacts. They don't have the help that they need. So that is why I set up this COVID task force in the second wave when there was a humanitarian crisis. And the focus of that task force was to help people round the clock with such resources. So again, so after you've decided the focus, like I said, it usually comes from a personal experience or a personal motivation, or just something you read as a child, something you experienced as a child, something you experienced growing up. Like I experienced a lot of bullying while growing up. So I try to advocate for child's rights as well, because I feel that a lot of bullying and lot of fat shaming, lot of just horrible behavior in school for children, for each other, it leads to a lot of mental health problems in adulthood. So child mental health is something that is grossly neglected, and one of the things we do at Every Infant Matters is that we have a mental health screening app, and we screen children in slums, in underprivileged backgrounds, and we get them the mental health assistance that they need. So it usually comes from a place of personal experience or personal challenges that one has overcome. So then you decide a focus like that. It could be anything. And once you've decided the focus, you think of a model. You think of an idea. You think of a model. How can you make this problem better? How can you help this subsect of a population that is suffering with a particular problem? Right. So you have to just pick up. So once you've decided your focus and you've identified your target beneficiaries, you have to establish a low cost effective model. And it could be just anything. It could start from just you in your house making food and distributing to the poor children. It could be just as small as seeing an unwell dog on the road and taking him to the vet. It could be anything. And just, that is your starting point. Once you realize that if I can do this, a lot of other people can do it as well. So suppose just to give you a small example, suppose my idea is to help dogs, or to help let's say street children, and I feel like, okay, this is a good idea. If all of us take the responsibility of 10 street children and feed them daily, then this is something very low cost, right? It's not going to be very costly to just make puri aloo for, say, 10 children. And if let's say 7 houses do it, every day, one day of a week, and if you keep multiplying, so you can have 70 meals for the rest of and have the whole week covered. Now if you increase the number of houses, you can have more meals, and this is something which most people will be easy to, they'll be easily amenable to. It's not a very costly thing. So this is where the idea of partnerships comes in, right? Just as an individual alone, you can do very less. But once you identify like minded individuals, be it in your community, be it outside your community, be it nationally, be it internationally, once you identify like minded communities and build partnerships, they could be in the government, they could be donors, they could be other implementing partners, like this example I gave of other people in other houses making the meal. So those are essentially implementing partners. The idea is yours, but the people who are implementing that idea along with you are collectively increasing your impact. That is the last point. So you have to make a, how should I say, a measurable impact. So just 10 meals don't make a measurable impact, but multiply those 10 meals into 7 days, into say 10 or 50 more houses, see the kind of impact it will make. So the idea is that your small little idea should be scaled up with by utilizing the power of partnerships, and then making a measurable impact, then quantifying that impact. Because once you quantify that impact and you show that, okay, my solution, my model has made this much of an impact, has saved so many children from blindness, has saved so many children from hunger for so many days, then you can do lots of things with that impact. You can approach donors for funding, you can write a paper, you can get it published, and then attract donations. A lot of things work around the kind of measurable impact that you've got. So once you've got a focus, you decide a model, you build your partnerships, you make a business plan, which of course you guys will be great at. Once your business plan is in place, you do a pilot. You do a pilot of a small number of target group, and after the pilot, you measure your impact, quantify it, and then just take it from there. So I'm sure this is sounding very silly, my talking to management students about all this. So it's this is just my understanding of the model, and I'm sure there are a lot of experts who will be able to guide you better on how business plans are made and how how impacts are measured. But this is just my understanding, just to put it very simply for someone who has an idea and who wants to take it forward. Right. So coming to partnerships and how we utilized partnerships and created a high impact, replicable and scalable model. So what we did was that after we had identified our focus, that was that we want to prevent blindness in children by giving them vitamin A. Second step was that we had identified a target group, okay, 3 cities in India, 3 clinics, and children under 5 who are from a lower socioeconomic background. So then I need a solution. Now, the solution is that you give them 2 drops of vitamin A. Now, where does the vitamin A come from? So for that, I make a partnership with an American company called Vitamin Angels, which is a US-based 501c3 nonprofit, which gives free medications in 70 countries. So, of course, building a primary partnership is not easy. You need a lot of backing. You need a lot of support from people who trust you, who trust your idea. And once you have that backing, you get, an X amount. So I remember the first donation we got was 100 tablets of vitamin A and 1,000 tablets of albendazole. That is the deworming tablet. So we started from there, and slowly we built up on it. Slowly, Vitamin Angels developed a trust that, we are doing the right work. We are not selling off these medications. We are not throwing them and making them go to waste. These medicines are going to the children who need them the most. So once that trust had been developed, they also scaled up their donation, and we also scaled up our work. So this is the primary partnership that we had with Vitamin Angels. And after this, of course, we had implementing partners in India, which were Indian Medical Association, the Gurudwara charitable clinics, lots of all the people who were catering to the low socioeconomic strata, who had patients which was children of 0 to 5 from that background. We were just making up partnerships with them and sending the medication to them, asking them to keep an inventory of how many kids they've done, and then letting them send us the results. So this was in India. After we had our roots set in India, we decided to expand globally. And that happened when I went to this international summit and I met some people from Nigeria. And they were of the same thinking. They said that, the amount of children, they get an intervention. Their small organization that they have gets global recognition and partnership with an Indian NGO. For us, we get a scalability which is global, and we get our numbers go up, our impact goes up. So that it always has to be a mutually beneficial relationship, and it always has to be with like-minded individuals. You have to carefully select your partners. You have to be very careful. You have to see that they're not so countries like Africa, the corruption is mind blowing. So you have to really pick very carefully about who's not going to go around selling these medicines, who's not going to let them rot. And you just have to be very careful. And so I think in this part we were very lucky that we found very, very strong partners in Nigeria, Kenya, and in Dominican Republic. And the latest partnership which we've been able to do despite of COVID has been in Philippines. So Philippines, again, being they have a lot of slum areas which have a lot of impoverished, malnourished children. So we've been able to get to Philippines as well. So this is what partnerships do. They really take. So I started this in Ghaziabad, in in the interiors of Uttar Pradesh, and now it has spread. There's been a ripple effect, and it's spread to 4 countries and 3 continents, and it's just insane. So this is how partnerships help. So partnerships, of course, gave us free medication worth this huge number, and we were able to utilize established last miles in 4 countries. We were able to minimize costs and deliver a very high impact. Another very important part of partnerships is the kind of partnerships that you develop with your donors. It's very difficult to get donors in the first place. And donors often come at a very later stage when you've established yourself, you've done a pilot, you've shown how tangible and quantifiable your results are. And only then, it's only then that you get donors. And I think we've been fairly blessed that way. We've got a number of important donors. There's Zomato, there's Titan, there's DuPont, there's Pernod Ricard, there's SRCC, Refinitiv, lots and lots, Thomson Reuters, lots and lots of donors have given a lot of donation, and mostly they give donations in kind. And there's always, when you start working in the social entrepreneurship sector, you'll always be at a crunch for cash. Of course, unless you become really big, like Cry and Goonj and Helpage India. When you get to that level, then of course the sky is the limit. But initially, you'll always have a cash crunch. And even though the donors will give the commodities, like Zomato, so we're running something called the Million Meals Project. And so what the Million Meals Project is about is that they are freshly cooked meals that are given to homeless people and slum dwellers in 4 cities across India. Now, Zomato, of course, gives the food and sets up the kitchens, but how does that food get to the beneficiary? So there are different slums in different parts of Delhi. We can't have a kitchen in every part we can't have a kitchen in every slum. So we have to send a van with a driver and a helper. We have to have those big containers for the food. We have to have someone to distribute the food. So all these are distribution costs which have to be met by you, and you have to find small ways to meet these costs. They could be monetary donations from friends and family. From initially, this is the kind of money that you get. This is the only money you get. Either you're putting in your own money or you're just getting small donations. So, okay, just a very brief outline about what Every Infant Matters does. I've already spoken about vitamin A. We are giving vitamin A. We are also deworming children because worm infestations are very, very common in India and Africa. We have a holistic health program where we promote the good practices of childhood like breastfeeding, hand washing. We prevent stigma and discrimination. And we also distribute prenatal vitamins to pregnant women. So what happens in pregnancy in underdeveloped and developing countries is that pregnant women, they don't get rest and they don't get nutritious food. So as a result, their baby is malnourished. It's low birth weight, it's undernourished, and it's born in a very small for its age kind of setup. And once the baby is that weak, it's susceptible to a lot of problems both in infancy and later on. They're very susceptible to develop diabetes and obesity, which overall adds to the health burden of the world. So if we can tackle this problem in the womb itself, just by giving a bottle of prenatal vitamins for 6 months, then I think you're cutting down a lot of the world's health burden by just tackling this problem in the womb itself. So that's what we're trying to do. We give a bottle of 180 tablets, which have for 6 months, which are given, and these really improve the health of the baby as well as the mother. So, coming to a very important part of social entrepreneurship, and that is called last mile delivery. So, what happens is that, okay, so I'm sitting here in Delhi. I want to say help the tribals in Nagaland or in Manipur, and they don't understand my language. They don't understand what I am trying to say. They're not going to trust me or my any of my solutions. So that's going to create a lot of problems, right? I cannot go into a tribe or a community with my sense of dressing, with my sense of talking, with my language barrier, with my not understanding their socio-cultural and their religious beliefs. I cannot just say that you immunize your children. There are communities in India who believe that immunization is bad for children and it causes death. So they are not going to believe me. But if you empower someone from within their community who speaks the same language, you train community health workers from that area, locally from that area, you train them, you teach them your solution, you let him or her know the way to reach out to the community and make them more amenable to your solution, and to make sure that it's in line with their socio-cultural beliefs. So it could be a religious leader. So if a religious leader of a particular community is saying that this particular intervention is good for your children, or this taking the COVID vaccine is going to prevent you from corona, then they are going to believe it. So this is something called community empowerment for last mile delivery. So you empower and train health workers or any kind of community workers from within a community. There's no point. You always have to think global but work local. You always have to think in terms of expansion, but you cannot you cannot sit in Delhi and think that you can just reach the people of Manipur like that. It doesn't work like that. It's always about think global and work local. So this is what we did. Like, we have our partners in Nigeria, and the partner in Nigeria identified a certain number of community health workers in Nigeria, even in the conflict-ridden zones, in the tribal areas, lots of areas of Nigeria. So once he had identified the health workers, we gave the health workers a lot of training in what is right, what is wrong for children, what is the way things have to be done, what is the way these medicines have to be given. And once these health workers, they go into the community and distribute or disseminate your solution, it's much more acceptable to the people of a particular close-knit sort of background. So that's what community empowerment for last mile delivery is about. And an important part of last mile delivery is reaching places which are unreachable, which are either isolated by geography, like there were these islands in Nigeria. There are places in the northeast of India, Manipur and Mizoram, which are isolated because of rocky and mountainous terrain. So it's very difficult to get there. No, trucks and all don't get there. So if I have to send oxygen concentrators for my center in Manipur, I cannot just, tell the delivery or the DTDC guys to go give it. It doesn't work like that. I have to make sure that it reaches the nearest railway station. It is picked up from there. Then it's taken on foot up to the COVID center in Churachandpur in Manipur. So, it's always a task to reach these areas. And of late, what I've noticed is that there's a lot of research going on how drones can actually help in getting to these hard to reach areas, specifically for life-saving products like medicines or blood products. If someone needs an urgent blood transfusion and it can't reach, unless there is a drone which is delivering it. So this is an important part of last mile delivery. These are our workers in Nigeria. There's this Calabar River, which is quite a dangerous river, and there is an island at the end of it which needed medication. And this is just a picture of them going down via boats. So another, just something that we do, we have a lot of health camps. We have health camps in Delhi. We have health camps in Nigeria. Of course, COVID has put a damper on these health camps, but Earlier, medical outreach camps used to be our primary mode of, distributing the medication. We had a doctor and a nurse. We used to give free checkups and we used to give free medication. So this has been our impact so far. So this was 2017 to 2022. I think we started in mid of 2022. So I think 3.5 years, 69,117 children given vitamin A to prevent blindness across 4 countries now. Right. And these many children giving deworming tablets, 39,500 pregnant women have been given prenatal vitamins, and thus they have been prevented from having a low birth weight or undernourished baby. 70,000 families have been given a holistic health education, and so many more have been, educated to prevent gender inequalities and stigma. Right. Another important part of social entrepreneurship is system strengthening. So, of course, when you talk about any problem, be it climate change, be it education, be it health, all governments have certain systems in place, right? So, suppose I talk about something like tuberculosis. There is a government program called the, RNTCP, Revised National Tuberculosis Program. It's already in place. They have something called DOTS, Directly Observed Therapy short course, that gives the tuberculosis medicine under direct observation. But all of these, programs and all of these, all of these systems have a scope of strengthening, right? And I think it is innovative minds like yours who can strengthen these systems. So why not do it? So suppose you have an idea that can build up on the government's or the current system's, strength, then why not do it? So that is called system strengthening. So, I don't know whether you guys know that there is an entity called the ASHA worker in the country, accredited social health activist. So she is basically a lady who goes door to door in villages and, in those remote areas. And she's trained to give health education for children and women. She's trained to give immunization. But, as always, the outreach is very poor, and the the impact is not very good. So there are ways to strengthen this impact. And how do we strengthen? There are ideas that you and I can come up with to strengthen this impact. So the kind of idea that I came up with was, why not give these ASHA workers an app which can track, which can be translated into the local language, and it can teach them about how to use the app, and they can have a proper monitoring of the immunizations just on their tablets. So, stuff like this. Technology is always a great enabler for scaling. So just any technology idea, any innovation that you think of that can strengthen a existing system, then why not do it? So once, again, the way to do it is the same. You think of an idea, you do a pilot, you publish your results, you take it to Niti Aayog, you take it to, big stakeholders, and you say, see, this is my idea, and this is how it can improve upon the existing system. That's how system strengthening is done. So for us, what we did was that, like I said, we trained 100,000 community health workers in Nigeria, and we built upon the existing health system, and we added vitamin A and albendazole to the existing health program in the country. Another thing which we did was that there is a group of nuns and Catholic, workers who do healthcare for the poorest of the poor in 9 countries. But once COVID came into the picture, they had no idea on how to deal with it because they are informal healthcare providers. So what we did was we trained them in COVID. So this is just a way of us, strengthening the existing health systems in different paths, be it public or private. So, of course, this is what our goals have been the last 2 years or so. We have to develop technology. We're waiting for funding. We have to replicate in other countries. We are still not financially sustainable, so we're working on that as well. These are the new projects we're working on. We have to prevent sexual abuse in children. We are already working on mental health, and we have to add more nutritional supplements to our repertoire. And a priority, of course, is developing technology. Like I said, technology is a very good enabler for scaling. I think in today's day and age, we can make an app for just about anything. If we have the right idea, I think an app is a very, very good enabler. If you think about someone going door to door and implementing a change, I think an app is a very good way to track that change. An app is a very good way to train people. Like suppose you have training videos loaded on an app, and you train your community workers with that app. I think it's a very, very good idea to do it. It's a very good idea to track the movements of your health workers, to assure accurate data storage and to maintain inventories, to assure monitoring and evaluation, and also for us specifically patient retrieval, because we have to repeat the dose of vitamin A in 6 months. So to retrieve those patients, if we can have a database within the app and let the app send automated text messages for patient retrieval, I think there's nothing like it. Like I was saying, the ASHA workers, if they had an app which sent automated text messages that, okay, you're due, your child is due for a vaccination, like we get for our COVID vaccine. We get a message for our COVID vaccines. And why don't children get it for the normal vaccines? Measles is as dangerous as COVID for children, if not more. So why not do it for that as well? This is just the way apps can be used. So like you have ROI in businesses, you have something called SROI in social enterprises. That's social return on investment. And that's just the amount of money you quantify, the effort, the donation in kind, everything, and you see the return in terms of quality of life and everything like that. So our SROI was calculated by the One Young World, and it is said that for every US dollar invested in every infant matters, the return is worth 72 US dollars. That is the SROI. Again, there are a bunch of challenges when you come to your, starting an enterprise of any sorts. For social enterprises, there are sort of different sort of challenges. There are when you see, you can't do anything unless you have the government's approval, and that is very difficult to get. It's very difficult to get past the bureaucracy. The government funding is very difficult to get, and it's often a lot of the government officials are, of course, in India, they're very corrupt, and it's very difficult to get that. So NGOs are usually not welcome. And of course, the other challenges have been maintaining quality. Is the work being done at all? Like I said, I have implementing partners all across the globe. How do I know that the people in Nigeria are not wasting away the money? So the way to assure that is you do surprise quality audits, and you send an auditor without there being any contact between the auditor and the implementing partner. So you get a clear picture of what is being done. Getting funds, of course, is a very, very big challenge. And working with local people, like I said, they don't know, we don't know sitting in Delhi what their religious beliefs, what their socio-cultural practices are, and we don't want to tamper with them. Often infuriates certain tribes if you try to go into them as an outsider. So how do you do that? And the way to do it is you empower the community itself. And of course, translation of any of the apps into, a readable model is obviously tough. I think the best way to work around the government is to work with trusted people who have shown some faith and some trust with you, and then take it from there. COVID, of course, has led to some insurmountable challenges. All the funding which was directed for social enterprises working in XYZ areas have been directed to COVID relief. And field work has been risky for health workers. So we cannot have medical outreach camps. We cannot have a gathering of so many people at one place. There's always been, like for COVID relief, we always get funds in kind. We get concentrators, we get BiPAPs, we get PPs, but we don't get any monetary donations to carry out the distribution. So that is also difficult. So, like I said, one of the major enablers for scaling is hire and train local people, work with the local NGOs, work with the local government. So suppose there's a village or a tribe, you work with the local leaders. Technology, the biggest enabler for scaling. Have a franchisee-like model, have your, whatever your model is, have it like a set model and let others implement it. Have a certain level of sustainability when it comes to finances, and always be flexible. Do not be very rigid about what you're doing and what you're not doing. Of course, never compromise on your core principles. Never ever compromise on your integrity, specifically when it comes to finances. It is very, very easy to fall off the slippery slope and get into taking kickbacks and taking all of those things. But trust me, it's not something you want to do. It's not legal, and it's specifically not good for yourself as a human being, and or for your karma, or for your, you want to get up at the end of the day, you want to sleep happy at night, you want to get up in the morning thinking you're doing something good, not thinking that you using the government's money or the donors' money into your own personal benefit. So that is not something that's not the kind of feeling I would recommend for anybody wanting to go into social entrepreneurship. Right. So, like I said, there should always be a training module, maybe training videos, and impact measurement is always very, very important. The model that you come up with should be easily replicable across geographies and across communities. That is very important. So, that, of course, minor modifications are necessary every time you go into a specific area or a community, but overall it should be replicable. Yeah. So, like I said, we've happy to announce that we've been able to scale to the Philippines in spite of the challenges that COVID threw to us. We're working in 6 municipalities in children, and we've already given deworming tablets to 8,500 and vitamin A to 9,000 children. So, this is what my journey has been about, and I hope I could inspire some of you to take up social entrepreneurship in the future. And with your support, of course, the fight will go on. We're always looking for volunteers. We're always looking for help. So if you want to reach out, please do. I'll leave my email and LinkedIn at the end of this. Thank you. Oh,
Thank you very much, ma'am.
Oh, there's this last slide. So,
Okay, sure.
So just to talk about the kind of COVID relief work that we did, like I mentioned that I was running this COVID task force where we were helping people in the second wave procure resources, hospital beds, teleconsults, everything. So we had 165 volunteers working around the clock, and we have been able to help starting from back in April of 2021. Up till now, we have helped almost 26,000 individuals with essential life-saving resources, and we've saved, I think, around 26,000 lives like that. We have supported government hospitals, medical colleges, local people. We've given PPEs, pulse oximeters, BiPAP machines, oxygen concentrators. We're running 3 COVID centers in the northeast of India, in Churachandpur in Manipur, in Signat in Manipur, and one more. I'm forgetting the name of that village. And there are, like I talked about, the Million Meals Project. It started in the second wave when the migrant workers were just starving. There are, of course, there's a community COVID care program going on where there are 25 health workers in Delhi and Rajasthan who go from door to door, and they give people COVID positive education, and they encourage people to get vaccinated for COVID. We had a bunch of vaccine camps back in June and July, and when the vaccine drive had just started, and we were able to vaccinate 9,000 people for COVID-19. And the COVID task force numbers have gone up. I didn't know that. So the COVID task force has helped 32,000 people. And the World Economic Forum has listed us as one of the top 50 last mile COVID responders in India, which I think was one of the biggest honors that we've received. But, the honors and success is sweet, but it's the results that matter. So we have to think about the need. We have to think about what the world in the pandemic wants. We have to think about what children need. We have to try to get to areas like Yemen. There's been absolutely no access to these conflict-ridden zones because of the, red tape and the political barriers. But we have to try to get there. And I think that's what social entrepreneurship is eventually all about. Yeah, so now I'm done.
Thank you so much, ma'am. Thank you for sharing your experience and insights. I'm sure that students have learned a lot and got motivated about social entrepreneurship.
Thank you so much.
And I think students have also a few questions to ask you.
Yes, so, of course.
I will request Katta Rajashekar to take over the Q&A session. Over to you, Rajashekar.
Thank you, Sujata. Now we would like to open the floor for discussion. Students, you may raise your hands and ask your questions. Yeah, Ankit, you may ask your question.
Thank you, Rajashekar. Thank you, ma'am, for this insightful session. So, ma'am, what I want to ask is, in a startup module, like, what is the right time to register in the government, with the government and other things? Like, at what time we should register this startup?
So I think as soon as you have your basics in place, like we registered pretty early, we registered as a Section 8 not for profit with the government. So without registration, you actually can't do much. So you have to register it as soon as possible. As soon as possible, as soon as you have your paperwork in place, you have your bank account, you have your board of directors ready, you have a good CA and lawyer to help you draft the policies. That is the best time to register, and as early as you can do it in the course of your social enterprise, it would be better. Because without see, once you're registered, it takes 6 months to get 80G and 12A, which is the tax exemption, and then it takes 3 more years to get FCRA, which is for the international donations. So without 80G and 12A, you cannot accept most of the donations. And इसमें तो social enterprises में तो most of the work goes on donations only. So you can accept, but your donors will not get a tax exemption. So that is important when you look at it from the donor's point of view. So it's always wise to register as early as possible.
Thank you, ma'am. Thank you.
That's welcome.
Sneha, you may unmute and ask your question.
Thank you for the presentation, ma'am. It was really eye-opening and inspiring. So I agree to what you said, that number of blessings we get is incomparable to the profit we generate. But when someone starts entrepreneurship, the first thing they think about is profit. And when someone think about doing something social cause related, so they know that amount of profit they will generate would be limited, or amount of cash they will get. So how and where these two find synergy? How can someone work for the society as well as make some amount of profit for themselves?
I think, when you're working for the society and when you start a social entrepreneurship, any kind of personal gain to yourself is always at a backseat. So always think about doing it only when either you have no financial responsibility, no major financial responsibility, or when you have a side, day job, which is giving you a certain level of financial security. Like for me, I was always a doctor. I was always working. For the last 3 years, I was working with the government. So I always had a steady income, which was coming from the medicine. And that took care of my financial responsibilities. But at the same time, in the evenings and on my days off, I used to work on this. And I used to put in extra hours for this cause. And it's this cause which has got me a lot of accolades and a lot of, recognition in the nonprofit world. And, I'm speaking here because of Every Infant Matters. I don't think I would be here had I just been a pediatrician. I did something different and thoda hatke. That's why, people have started recognizing these efforts. So it's always a challenge. I was blessed that way, that I had a family, in the sense that I was not married. I did not have any children and a family to support. It wasn't like that. So when it happens to be like that when you have to support your family, then I don't think that is the right time to venture into social entrepreneurship, unless of course you're getting a job in an already established social enterprise. So suppose one of these big Nudge Foundation or Goonj or someone offers you a job. That is also a good way to get into the sector. You pick up a job which is well paying with one of the established non-profits. You learn the tricks of the trade. You learn what non-profit science is all about. And then once you're a little financially secure, you have some savings, then you venture out into starting something of your own. That is also a good idea. So either of the ways, either you completely, think about this being your focus. And if you're married, then let your partner take on the financial responsibilities for a while. This could also be an idea. Just you have to find a time in your life when you are ready and you are, in a place that you can afford to do this.
Thank you for the answer, ma'am.
Aditya, please unmute and ask your question.
Thank you, Rajshekar. Thank you, ma'am, for such a delightful session.
Thank you.
I really like the initiative about the world hunger. I think that it is one of the biggest problems currently we are facing. And So before any venture, when we start, it is important to set a measurable goals. Like for a
Yeah.
corporate, it can be increase in market share, increase in profit
Yeah.
margin, revenues. But for
Right.
NGOs, as we have just discussed, that the profit is not a major goal.
Right.
So
Right.
what should be such measurable metrics by which we can see that our goals are being accomplished?
So I think it depends on the cause. Like for us, we had a target set of say 5,000 children prevented from blindness in the first year. So your goals have to be result oriented, not profit oriented. I hope that makes a little bit of sense. I mean, um, I think as management students, you guys would be better knowing this, but I think it's always about. I think these 5,000 children, they can ultimately be quantified and converted into money terms as well. That's how they calculate our SROI. That's how they calculate our return on investment, because they calculate the number of lives saved and the number of quality of life improved, and then they quantify that. So there's always this measurable impact that is there, and your goals should be more related to A, results, and B, on scaling. On suppose you're starting in some a venture in your locality. In say, suppose like I stay in Sarita Vihar, so I suppose I'm starting a feeding project for children in Sarita Vihar. So I should be okay. I'm going to take up 3 blocks by the end of 1 month. Then I'm going to take by the end of the year. I want to complete 3 more localities, right? So suppose I want to cover whole of Southeast Delhi. So that those scalability aspects should be more into your goals, and along with also how you gradually improvise upon your model. Like for us, we have the paperwork for technology in place. We're just not able to find the funding to do it. So again, these are all goals. The goal is to become financially sustainable. The goal is to reach 3 more countries. The goal is to make technology and save an X number of more lives in the next year. Improve an X number, save a Y number, okay, educate a Z number. So these are all tangibles here. I hope I'm making sense. I mean, this is not my area, but I'm just trying to, give you a sort of a overview.
Thank you, man. It was very detailed, and yes, I agree with you. Thank you.
Garima, please unmute and ask your question.
Thank you, Rajshekhar, and thank you, Radhika ma'am, for such enlightening session, I would say. So, ma'am, my question is, like in country like ours, where everything becomes a taboo, it doesn't take
Right.
much time to turn
Right.
into a taboo. For say, if we talk about child sexual abuse, it is still a taboo, and I'm not sure for how many years it's gonna be a taboo. So for
Right.
any social organization, how they should deal with, how this how this taboo can be managed. I mean, awakening people, and how this is managed, ma'am. This.
So, this is a question I get very frequently, and I've also struggled with taboos all my life. Be it, being unmarried at 30, be it not focusing on just one career. All these are also taboos in the country. Leading an organization as a woman is also a taboo. But what I feel is that, if you start from your own family, and trust me, families have the most number of taboos and they have maximum resistance, specifically when it comes to Indian women, right? So if you start from your own family, start with changing their mindset. Start with your immediate family, your friend circle, and then let it take ripple effects into the society. That is the only way to do it. Of course, others will say कि नहीं आप ये camps करो, आप educational videos करो, आप reels banao and stuff. Of course, those are ways, but the realistic way to do it is this. Now, in my family itself, there are elders. Of course, as much as I love and respect them, they have different ideas. Like if I come and say that, I got this very big achievement, or a patient in COVID wrote a very long email to my boss saying how much this doctor has helped, even though the patient didn't make it. But they wrote a very long appreciative email for me. And when I showed it to my grandmother, she said, "ये सब तो ठीक है, असली काम पे आओ. असली काम भी get married and settle down." Okay. So this is just something which all of us face as girls of this country. So if we can change the mindset in our own family, for starters, that look, this is not acceptable. This kind of attitude is not acceptable. Okay. all this will happen when it has to happen, and at the same time these things are also important. So you start with that and then take it on to advocacy and activism later. So the starting point should always be an immediate circle, and let it take ripple effects from there. So this is my understanding, and this is my experience in the field of fighting taboos. Yeah.
Thank you for the answer, ma'am.
Anything else?
Yes, ma'am. We have questions from YouTube as well. Can I take this?
Of course.
It's a question from Kunal Datta.
Hmm.
In your venture, what are the two most important strategic decisions you took in combining both social and financial mission?
So we don't have a financial mission. We just have a social mission. But strategic decisions, of course, there have to be a lot of strategic decisions. There's a strategic decision when it comes to focusing primarily on, see, our idea is to help. Now, in the COVID pandemic, if we're not getting monetary donations, we're just getting donations in kind. But those donations in kind are so important. We're getting concentrators. Oxygen was something which killed so many people in the second wave, lack of oxygen. So, just one concentrator can impact a lot of lives. So why not take it, and why not find other ways to, go about the distribution costs. So there are always ways and means to get these things done. And I think the strategic decision is that you take whatever you can, and you think about the kind of people it will help. I think that is the only strategy that I apply. A lot of people tell me, that you should focus on one thing. Your mind is all over the place. You're doing vitamin A also, you're doing COVID relief also, you are doing mental health also. They keep saying, ek cheez pe focus karo, you'll get more funding. But my idea is that, there are so many problems, and if someone has approached us with a problem, then we cannot turn a blind eye towards it. That is not how the mind of a change maker works, at least not for me. So I cannot only be focused on one thing. That's not what I can do as a person. But of course, the people who are very, very senior up high in this field always suggest that if you pick one focus and keep at it, then you get more funding and you get more traction. But that has not been my modus operandi. So my strategy has always been help whoever you can. So that is something.
Yes, ma'am. I hope Kunal Datta's question is answered. Ma'am, we still have many hands raised, but due to paucity of time, can we take last two questions?
Yes, of course.
Yes. Nandini, you may unmute and ask your question.
A very good afternoon, ma'am. Thank you so much for the Thank you so much for the enlightening session. Ma'am, I just wanted to ask that during COVID, in the initial days of the pandemic, like people were very scared to come out of their homes. So how did you and your team manage to serve the society at that time?
So, of course, for a while, all the core projects were at a standstill. All this vitamin E, medical camps and all, in the beginning, they were at a standstill because even we didn't want to expose our health workers. So, and at that time, we had no idea what it's going to be like. So then what we started doing was that, at that time, the need of the hour was masks and sanitizers for the poorest of the poor. So, we found ways to distribute them in our own way. Like I used to work in a hospital, and hospital staff was at the highest risk at the time. So we started with that. We used to, obviously in the hospital, used to be in PPE only. So me and I had roped in a couple of other volunteers. We started distributing masks, sanitizers to the, I was working in the government that time. So there were a lot of poor patients who couldn't afford sanitizers. So we used to give it to them. That's how we started. Then, of course, once the country went into a lockdown on 21st of March, the immediate need was of food, because hunger would have killed more people than COVID back then, because the daily wagers and migrants, they were stranded. Then we started making these ration kits, a COVID care kit of 20 kgs of rice, 20 kgs of atta, 4 types of dal, spices, oil, and we started distributing these in slum areas. So, we partnered with some local NGOs who were already working in the slums, and they had already got people going in there door to door. So then we just, partnered with them and let them do the distribution. So there's always a way of partnering up and getting these things done. That's how we managed.
Thank you, ma'am.
Aniket, you may ask your question.
Thank you, Rajshekhar. Thank you so much, ma'am. Ma'am, the session was full of motivation. Ma'am, just as you mentioned that you need sufficient amount of funds to run the initiative. So I wanted to know, like, how do you go on doing marketing for your NGO so that people are able to associate with you or maybe contribute in any form to your NGO?
So, it's always a ripple effect. You start very small, and of course, social media is a very big enabler. Then you attend a lot. So, I attend a lot of youth led conferences, and I met a lot of like minded individuals from in those youth led conferences, a lot of networking. So, networking is a very important aspect of social entrepreneurship. Once you network, the word starts to spread in the donor communities, in the business communities, that, these people are doing very good work. So, this is all done once your pilot and tangibles are in place. Once you have something to say for yourself, that you have made a measurable impact. So now you can go and in a way show off about it, and then attract potential donors, attract more partners, attract. So always a ripple effect. One thing leads to the other. You attend one conference, you get invited to 3 more. You attend one conference, you meet people from 3 more countries. So it's always a ripple effect, and you keep once you are in this field and you are doing good for the society and for the people who are underprivileged, you'll find that good things come to you automatically. You become a sort of a magnet for your aura attracts people. I don't know, you guys found me on LinkedIn, so that should say something. Yeah.
Thank you so much, ma'am.
Yeah.
Thank you, students. Yes, ma'am.
Okay, perfect.
Thank
so
you,
I'll just
students,
leave
for
my email, and you can find me on LinkedIn. And if anyone wants to volunteer, we are always looking for people. Wants to intern, there also you can reach out, and you can get in touch. Okay. And Vipasana, can you share a recording of the session with me?
Yes, sure, ma'am. I'll send you the recording.
Okay, thank you. And send me a picture of that tree thing also, which you did.
Yes, ma'am. Surely we'll send you everything.
Okay, yes. Bye. Thank you for having me here.
Thank you so much, ma'am.
Bye.
Students, you may leave the call.